Hi, this is Sam from Teacher.is. Welcome back to my YouTube channel. Today's topic is diabetes and we are covering fourth part of this video series when we will talk about medical management of diabetes mellitus. Now, another common topic that is being asked all the time is management of diabetes. So if we talk about medical management of type 1 diabetes mellitus, maintaining a blood glucose in the normal range is our first motive, which is between 4 to 5.5 millimole per liter. Also, there is an indication for insulin therapy. We need to do a constant HbA1c test, which is indicator of glycemic control over 3 months period. Diet is important. There should be low carbs and high protein in diet of type 1 diabetic patients. You would see they are usually thin, and exercise still benefits them. Still talking about type 1 diabetes patient, what is the insulin regime? So there are two types of regime. There is intensive regime versus standard regime. Intensive is more beneficial for type 1 diabetic patients, while standard regime may be for type 1 or type 2 patients. What is an intensive insulin regime? It is a regime which attempts to mimic the body's normal pattern of insulin secretion and deliver replacement insulin during the concepts of basal and bolus insulin coverage. That means like during breakfast, lunch, and dinner, whenever you are consuming glucose, that's when it is more efficient to give the insulin. There are basically three approaches. Either you give them 3 or more injections per day, or an insulin pump with a frequent blood glucose check, or there could be a long-acting insulin given once or twice a day with rapid acting during the meal times, or a rapid acting with pump for all day. Talking about intensive insulin therapy, there could be a combination of approaches used. Either you would use a long-acting insulin injection thrice a day at breakfast, lunch, and dinner. For example, glargine and second is Detimer. They are two commonly used ones. And the other way is using rapid-acting insulin via insulin pump, and it would give insulin as a bolus of breakfast bolus, lunch bolus, and supper bolus. And that's because there is a continuous monitoring of blood glucose via the insulin pump, which is like installed subcutaneously, and it always keeps a check of what is the blood glucose at the given time so that it can dispense that rapid acting insulin. So that was all about type 1. Let's see how would be the medical management of type 2 diabetes mellitus. It is similar to type 1. Normal blood glucose with HbA1c should be less than 7%. A stepwise approach of diet modification, physical activity, and oral glucose lowering agents is given. Lifestyle adjustment is critical, and that is the first approach towards treating type 2 diabetes mellitus. Insulin is prescribed when it is needed, and control of comorbidities such as hypertension and increased cholesterol is controlled, and also smoking cessation is highly recommended. Once again, lifestyle adjustment is the most critical part in initial management, and if after lifestyle adjustment prescriptions still there is no result, that's when we go to the medication or oral anti-hyperglycemic agents. Talking about the common ones, the most common ones, that would be sulfonylureas and bisguanides. Those two would be the first line, while the second or the secondary prescriptions would be thiazolidinons and maglitinides, which are the secondary medications given. So the first one will increase peripheral glucose uptake, while maglitinides will stimulate insulin secretion. Similarly, if we talk about what is mechanism of action for sulfonylureas, it increases insulin release from pancreas. For example, glyburide is a very common one that is used, and bisguanides actually increase insulin receptor sensitivity, and metformin is the most classic bisguanides. Why is metformin so popular? Because of two main reasons. Firstly, it rarely causes hypoglycemia. Patient is not going to faint because they are on metformin. And secondly, it does not cause weight gain. Lastly, when you are here with Teacher.is, you need to know what is the dental management of diabetes mellitus. So first of all, history is going to be critical. You need to know current treatment. Is the blood glucose under control? Ask all the possible questions. What is the status of complications? Is there any micro or macrovascular complication that you should be aware of? Any comorbidities such as cardiovascular diseases that you should note down? What are the regular recall visits? It has to be more often for diabetic patient compared to the non-diabetic patients because there is an increased risk of periodontal disease, and you may definitely see that periodontal status in those diabetic patients once they are in your dental chair. Appointment scheduling, you should always avoid hypoglycemic incidences. How would you avoid that? By giving them morning appointments, ask them not to skip their breakfast, make sure their insulin regime is normal, their older anti-hypoglycemic agents are consumed at the time when they usually consume, and they come for the appointment when they are usually not feeling hypoglycemic. And as a dentist, I always keep an eye on observing any signs and symptoms of hypoglycemia when the patient is in chair. What are some of the mild and severe symptoms? The mild symptoms include anxiety, sweating, tachycardia, tremors, while the severe symptoms include mental status change, seizure, and coma, which you don't want to see in a dental chair. And that's all about this video. In the next video, we will talk about how would you manage a complication or a hypoglycemic accident in a dental office and what are the dental management of diabetes. Make sure you subscribe to my channel because I'm really looking for some subscribers. Share this with a friend and also hit that like button so I know that you enjoyed this video. Post in the comment below what are the questions you have and what other topics would you like me to cover in this way. Is this format of video and lecture effective for you, helpful for you? Please let me know in the comment section below. Thank you so much and bye-bye.